joining us now, Elaine Parker. She is the president of the Job Creators Foundation. And Elaine, I just, for the life of me, it is stunning what you guys have done with your Healthcare for You platform. I believe that from what people I've talked to, it is actually going to be one of the platforms for Trump's reelection campaign. I've also talked to somebody, Elaine, who said that it might get inserted into the Republican National Committee platform for 2020. Have you heard any of this?
Well, I certainly have heard that it's been well received everywhere. And that's because it makes sense, and that's because it's rooted in real research, market research that's never been done before of 25,000 American voters. And so it makes sense that it would be well received. It's about having personalized health care. That's what the American people want. They want choice. They want affordability. They want to restore the doctor-patient relationship that's just really been lost under Obamacare. And they want to get the D.C. bureaucrats and politicians out of their healthcare decisions and bring it back to where it's supposed to be, between them and their doctor.
How do you take what you've done? And anybody can just look at this. It's so easy. Just go to healthcareforyou.com, healthcareforyou.com. And I know I've had you on a couple times, but just for our listeners that might not know what this is, Job Creators Network and the Job Creators Network Foundation frustrated over the fact that there was no healthcare alternative to Obamacare. Certainly there was no repeal and replace, because there was no replace. And the Republicans tried to piece something together from top down. It was a disaster because they never had anything. So Elaine Parker, Job Creators Network, went out there and said, okay, let's get the funding to do a study, and let's build a program from the bottom up. Let's meet with doctors. Let's meet with patients. Let's meet with families. Let's meet with single people. Let's meet with young people. Let's meet with old people. And let's find out what they want. And then let's build a common sense plan from the grassroots up that the Republicans could adopt. They rolled it out. White House loved it. They're running with it. How do you turn this into a bill?
Well, I mean, what we're doing is a groundswell. You know, we're working with leaders, community leaders, business leaders, political leaders, physician leaders, physician advocacy groups, and we're going to do a groundswell. It's going to be very grassroots, just like we did with the tax cuts campaign 2 years ago, so that the American people can tell Washington what they want instead of what we had with Obamacare, and that was a backroom plan that politicians told the American people what they were going to get. And when you think about the fact that we talked to 25,000 Americans that included Democrats, Republicans, and independents, they told us that they want a personalized health care plan that provides peace of mind, choice, and affordability, even if they have a pre-existing condition. And to do that, we have to fundamentally change how we think about health insurance in the country. We need to expand health insurance accounts. We need to put decision-making back and dollars back in the power of healthcare consumers, of patients, so that they can decide the kind of plan that they want. We need to roll back the essential plan benefits under Obamacare, which is restricting and depleting choice in our healthcare markets, and allow states to actually regulate their markets and allow different types of policies into their states, so that you can actually buy the health insurance policies that you need. Instead of paying for maternity benefits if you're a 65-year-old man. You simply don't need them. We need to expand access to direct primary care. I know you've had some direct primary care physicians on for the last couple of weeks talking about what that means. It's fee for service. It's cash for service. You're not dealing with any of the middlemen or insurance companies. And the cost of that kind of care is literally, pennies on the dollar compared to having an insurance company involved. And you think about a simple blood test that goes to a lab through an insurance company is $100 versus go through a direct primary care physician, you're talking about $3.50. That's literally the cost between doctor and patient making all the decisions and taking out the middlemen. I mean, it's incredible how affordable healthcare is What's not affordable is the complexity of our system.
Okay. The way you outline this makes such sense, right? But one of the main things that I want to ask you about is we had a doctor on last week, and I can't think of her name offhand. You probably know, but she got out of the Medicaid Medicaid business, right, or the Medicare business. She just got out of the paperwork. She got out of all the insurance business. She only takes cash, right? So it's a cash op. And I had a doctor in Atlanta that we had gone to a long time ago who was one of the pioneers of doing this, where there's no insurance. You want to go, you give a check, or you give me your visa. And she was telling me, Elaine, that that the raw costs, because she had no paperwork, no filings, no medical billing, none of that, as a cash business. She told me that the raw cost had gone down on every service she has 50%, 40 to 50%. Prescription drugs had gone down, that she could dispense them. Or she got a pharmacy license and she gets the generic ones. They were down like 90 or 95%. And what she was telling us is that, look, I have the model. If you take all the bureaucrats and all the middle people and all the paperwork out, it's 50% under just what you're being charged now. How do you respond to that?
It's an amazing model for healthcare delivery, and by expanding health savings accounts and allowing patients to utilize direct primary care, it really does bring down the cost of medical care in general. It's like I said, it's not expensive as long as you take the complexity of the system out. And the way many of these models are set up is it's like a monthly membership. I mean, think of your gym membership. It's anywhere from, I've seen anywhere from $40 to $70 a month.
Right.
And you have direct access to your doctor whenever you need, either via telemedicine. You can text your doctor, you can Skype with your doctor, or you can go in for an appointment. But the idea is your doctor knows you because, John, a lot of these doctors under Obamacare are having to spend more than 50% of their time doing paperwork. So guess what? In the end, they have to meet payroll themselves. They have to run their offices. They have to pay their electricity bill. They've got to buy new equipment. They end up having to see patients, more patients in a day than you can imagine. Imagine having to turn patients over, like you would turn over a restaurant to meet your basic needs. You got to see patients every 10, 15 minutes.
Right.
How much do you think your doctor is absorbing of what's wrong with you and understanding, how you work and what kind of healthcare needs you have? In the case of Dr. Rutherford, who you talked to last week, she can spend as much time with her patients as she wants, because the cost of healthcare is all rolled up into the monthly membership that the patients are paying her to be part of her system. And it's very affordable to patients. And like I said, a simple blood test is, which costs, if they're going through your hospital or lab, is $100, and the same blood test through Dr. Rutherford is $3.50.
Unbelievable.
I mean, it makes total sense.
It makes total sense. We're with Elaine Parker. She's the president of the Job Creators Foundation. They are the author of healthcareforyou.com, which is the platform that we believe the president is going to adopt and run on in his reelection campaign as an alternative to whatever Democrat nominee is who will be running on Medicare for all, healthcare for all, which is a government takeover of your healthcare system. Elaine, I've got a question here from one of our listeners, Andrew in Glen Allen, Virginia. Andrew says, can you ask Elaine, what does an office visit cost? What would be an average expense for something like a strep throat test for a toddler? I'm curious as a parent. Great question.
If he's referring to under a direct primary care delivery model, it's a monthly membership fee in most cases. But with the direct primary care model, the point here is they post their prices. I mean, you know exactly what it costs. The reality is you can shop for these types of healthcare needs. You can call around and talk to some of these offices and say, what do you charge for a basic office visit? What do you charge for, an annual physical, those kinds of things. We know that when you have price transparency and competition, the price of things come down. And we're seeing that in this delivery model of healthcare for certain. It's amazing to me. And LASIK surgery is a perfect example of pricing coming down. When it was first introduced in 2000, or since it was introduced in 2000, the prices have come down 50%, and the procedure's only gotten better. My kids, when they went into braces, I didn't really have any kind of coverage through my dental policy for orthodontia. So what did I do? I called around, and the prices are very transparent. And I went with the best service and the best price, and it worked out just fine for me. But wherever you see price transparency, you see affordability and competition.
Well, and I think to answer Andrew's question in Virginia, when you go to direct primary care, it's not like now what we're doing is it's like who's in our network and who do we pay $10 to, right? You never really know what the cost is. Now under this system, you're paying a monthly fee, much like I pay at wherever I go with Planet Fitness or whatever. I don't know, it's $25 a month or whatever. You pay a monthly fee and then you have so many visits, and that is in lieu of your $10 copay. But the bottom line is the prices that the doctor charges go way down because there's no middleman and no paperwork. And I think what you've demonstrated is if you take out the administrative cost of administrating the bureaucracy of all this paperwork for insurance, and obviously there has to be some insurance, and for the government being involved, it is a tremendous savings to the patient, right? Because then it just goes to the doctor. It's a doctor-patient relationship. Let's take the antithesis of that, which is the Warren plan, which the government takes over the entire healthcare system, right? I mean, it's almost like saying, what would you prefer to wait in line and have the government tell you what you can and can't do, or just call the doctor up, get the best price and go, right?
Exactly. And direct primary care is one facet of this framework.
Right.
The idea is to expand health savings accounts so that patients can make the choice. And if they choose to have access to direct primary care, they can, once we roll back the essential benefits under Obamacare, and there's more choice in the marketplace for insurance plans, you could contract for direct primary care and get a catastrophic plan if something major happened. We obviously can't shop for our next heart attack. So we do need to be prepared for that aspect of it. But if we have, right now employers own your health insurance policies because they provide, 85% of us get our insurance through our employers, but they own it. So if you leave your job, it stays with the employer and you've got to go somewhere else and get insurance somewhere else. If you own the plan and your employer opts out of providing insurance and opts into funding a health savings account for you, and you own the policy, you have more portability. You own it from job to job. You own it in and out of the labor force. And when you leave, you take it with you. And so you have continuity of coverage. And that actually goes a long way to helping with pre-existing conditions because you have continuity coverage. It doesn't solve all of the problems with pre-existing conditions, but it goes a long way when you have no break in coverage whatsoever. These are the types of things that if you roll back those essential benefits under Obamacare and allow the states to bring in more policies, more choice, then people can select either a plan that works for them directly and stick with insurance, or they could contract for direct primary care and just have a catastrophic plan. These are all the choices that aren't available to us anymore. I mean, more than 50% of the country has 2 or less choices for insurance plans, and 1 in 5 only has 1 choice. So why would we want, and that's a direct result of Obamacare. That is a direct result of injecting more government in a more complex system. So why would we want to move to more government under a Medicare for All system or even the public option? And mark my words, John, the public option is just a slower way to get us to Medicare for All. So
it's a down payment.
To me, that's
right.
Yes. Yeah, it's just a slower way. Whether we get there in 3 years under a Warren Sanders plan or a few years later under, Biden's plan or Buttigieg or any of the others that are supporting a public option so that they sound more reasonable, we're headed that way. And the reason why is because all you have to do is look at Obamacare. It is reduced choice and increased price. The average family plan has gone up almost 200% under Obamacare. So, and so to think that it's going to be free under a Warren plan is just ridiculous. They all want the end goal, John, is Medicare for all, government-run health care. It's just a matter of how fast we get there.
I don't think there's any doubt about it. And look, your plan is right now it's been unscathed because nobody's really looking at it. But once we get on the campaign trail, it's going to come under great scrutiny. Because this really is going to be the choice. The president's going to adopt most of what you said, and he is going to present this as an alternative to a government takeover of health care. And it's going to be an interesting debate. But again, Elaine Parker, Job Creators Network, the little engine that could and would, with very limited resources, is the one that took on the healthcare alternative debate in the United States. And you guys have come up with a platform. Now it's a matter of we got to get somebody to sponsor it. You got to get a bill. You got to get the White House to take it, not the White House, the Trump campaign, I should say, to take it as a 2020 platform for their re-election campaign, and then get it written into the RNC platform. And I think you're moving in that direction. So all I can say to you is great job. And it really shows you what innovative minds can do when you actually talk to the people that whatever you're doing affects. What a brilliant idea. Take it out of the hands of the politicians and put it into the people. Brilliant, Elaine. Absolutely brilliant.
Well, John, we feel very confident that this is going to continue with momentum. And part of the reason is that we're seeing a very big coalition in Washington build behind this type of framework. The Republican Study Committee came out with their plan about a week after ours. And there is a ton of synergies between the two plans. And so when you start building this kind of momentum with all of these groups in Washington that have been in the healthcare space for 30 years, and they're all getting behind this kind of framework with these types of elements for reform, I really think that this can be a plan to move forward, and that the American people will appreciate a real choice between Medicare for all or healthcare for you.
Okay, I'm out of time, and Kara's going to get really mad at me, but I've got a text from a caller. Eric in Richmond says, John, can you ask what the plan is for the big-ticket items, surgery, chronic disease? Aren't those the things that bankrupt families?
Well, like I said, John, as we roll back the essential benefits and people are able to purchase the type of health insurance that they need, they're able to, surgical centers can post their prices. So let me start there. Under direct primary care and direct medical care, surgical centers do post their prices for different types of surgeries. As I mentioned, we can't plan or shop for our next heart attack. So whether you need a catastrophic plan to handle those types of things, and we see more younger people who are very healthy need that type of plan. For somebody who's older or has chronic disease, then there will be choices for them as well. But we need to increase the choices to bring down the costs for all of those people. And
so basically, your answer, because I got to go. Your answer is choices and transparency, but plans would be available for that. I've got to go. Elaine Parker. Go to healthcareforyou.com. That's healthcareforyou.com. And I want to thank Eric in Richmond for that question.